Here's today's 5-minute medical update. So, COVID-19 at the end of May. Countrywide, daily cases are decreasing down from 30,000 new cases a day a month ago to 21,000 new cases a day as of the last week. And active cases in the U.S. are leveling off with daily deaths down over the last 6 weeks from 2,200 cases to less than 1,100 cases on average per day. Now, we've seen a significant spike in Arkansas, as you see on the big chart that I've been publishing since mid-March. And of particular concern is the increased slope in hospitalizations, which is tracking our worst increase period in late March. Now, whereas Arkansas's community cases were well on track to stay below 4,000 total if the trends had continued as they were at the end of April, then I deduced that from my own research, exempting the prison population from the rest. Back on 5/22, I had suggested to our viewers that we were likely to have an increased uptick as a result of tripling our testing, but we're even 500 cases or so above what I had expected, even with that understood uptick. Governor Hutchinson yesterday on 5/29 did give us one good piece of news, and that is that only 5% of our total new cases are associated, and I quote, with barbershop, beauty shop, daycare, restaurant, motel, hotel, or gyms. He stated that we're not seeing a connectivity between COVID-19 and business activity in particular. However, interestingly, and this is particularly important to Arkansans, our state's increases have been dramatic and concentrated in two particular areas: the northwest area of Washington and Benton County, specifically Springdale and Rogers, as well as the southwest corner of Arkansas between DeQueen and Dardanelle. So I've been curious about this, and I began to investigate this over the last week, and here's what I have found. Now, to start, from personal experience, as of around May the 1st, I became concerned as I was running around our small town, noticing small groups of particularly teenagers and young adults playing games at the park without any social distancing, volleyball, sitting around picnic tables. And this was after, of course, the promising news of April the 26th to May the 1st, in which we started to move from phase 1 to phase 2. Now, with no mask and no social distancing, and I did notice that most of the people that I saw were Hispanics that were doing this. I even noticed, though, that one of our town's restaurants frequented by local retirees seemed nearly full the first day that we entered stage 2. So it seems as if the citizens have rather thrown off the shackles of the 6 prior weeks. And I've even had some with me share the frustration that they felt claustrophobic, like the walls were closing in. Dr. Nate Smith, in the governor's 29th briefing, stated the following: "We have had the largest single-day increase in community cases as of yesterday." He stated that 70% of this northwest Arkansas severe increase in Benton County was associated with Rogers, and 80% of Washington County's new cases were in Springdale, and that the average age of those new cases in Benton County was between 38 and 40, as well as Washington County, and that most of the new cases were in the Latino community. He noted a majority of those that we tested positive for coronavirus 19 in the state have been asymptomatic. In the last 2 weeks, he says, 74% of the people tested had no symptoms. This is associated and consistent with the uptick that I predicted to you regarding increased testing. Now, regarding the industries heavily employed by Latino community members where screenings were done, he stated that most of the cases did not come from actual employees of these industries. Dr. Smith went on to say that when the health department arrived and started doing contact tracing, that a lot of the cases were in family members or some of the social groups that the employees had been involved with, where the employee was not positive but family members were. Now, to go down to southwest Arkansas, despite a large outbreak in the Dardanelle area surrounding the Pilgrim's Pride poultry processing plant, Mayor Jimmy Witt stated, "The town itself hasn't seen a huge increase in cases, and they do not appear to be widespread within the community at this time." He noted, while the town has increased testing, some of our Latinos have expressed concern about getting the test without proper documentation. He says, "I've stressed to them that there's no need to fear. The goal right now is to get people tested, not worry about whether or not they have the proper papers." So I've researched further afield concerning this seeming minority issue and possible immigration issue, and found from Chicago to Oregon some of the following. In an Oregon News article, a reporter stated the following: Carlos, an undocumented Guatemalan who was one of the testing clinic's patients, never stopped reporting to his job cleaning a large supermarket even after he began coughing and feeling ill, said his wife Blanca, who did not want the family's last name published because of their immigration status. In Chicago, a CBS reporter stated in an article, Latino communities hit hard by coronavirus. And this is Adriana Diaz reporting on April the 23rd. And she quotes, illegal immigrants don't qualify for unemployment or stimulus benefits. Now let me state this. I'm the one that input the phrase illegal immigrants. She stated undocumented immigrants, which is a popular politically correct way of saying that. I choose the tried and true illegal immigrants. In Chicago, Jose Gonzalez, a cook at a COVID-19 housing hotel, stated, we don't have the benefit of saying, well, I should just stay home. To comment further, a Latino community labor organizer stated that many of our workers in our community are balancing, on the one hand, I don't want to get sick, and on the other hand, I don't want the crisis of being homeless because I can't pay rent and can't buy food. So back to Arkansas. The Hispanic community have even begun to picket against Tyson Foods and Pilgrim's Pride in Arkansas, as well as meat packing facilities in Texas. Hispanics there feel as though they've been discriminated against. And as you can imagine, most of the reporters across the networks that I found at least mentioned that being in the U.S. illegally might have some downsides. So here's a summary of what's actually going on with coronavirus in the U.S. and at home. We're better in the U.S. as a whole. In our testing surge, the illegal aliens as well as citizen minorities are now being tested for free with no requirements to produce immigration papers. And most of those testing positive are asymptomatic. Most of the new cases are coming from poultry and meat processing plant employees and their families and social networks across northwest and southwest Arkansas, as occurred in mid-May in the panhandle of Texas and the Fort Worth area. So we're seeing really what Italy saw early in the coronavirus crisis, with Chinese migrant garment workers from Wuhan, China, coming into their community, living in tightly packed, impoverished housing areas, and in people who must work to eat not having the benefit of native-born people's social safety network. And these are communities or have social traditions and a lack of social distancing and other safe practices, whether that is from lack of opportunity or lack of commitment. So, just from a physician's chair, I feel like due to the timing in our crisis, the Mother's Day and Memorial Day holidays were likely small super spreading events, especially in Arkansas among the Hispanic community in northwest and southwest Arkansas, especially among poultry and meat processing workers. Also, legal citizens have relaxed their precautions and let their guards down too far and too fast. Since we're having increased testing and increased detection of mild or asymptomatic cases, now the most important numbers to watch aren't the numbers of cases, but hospitalizations and deaths. Now, we'll continue to have outbreaks in areas where testing hasn't been successful before due to lack of access or previous unwillingness of the local population due to fear or social concerns. And remember, even though 99% or more of cases will recover, especially in those under 60 years of age, in otherwise healthy people, the vulnerable are still vulnerable, the virus is still present, and we all still need to be careful. Now, due to what's happened in Arkansas in particular, all the above that I've stated, we're going to continue to have social distancing, mask wearing, careful hand washing, and other considerate and safe precautions through the entire month of June to get beyond this. If we don't, we're going to bring the delaying of the beginning of the school year, as much as I disagree with this personally, into legitimate play. One danger of the asymptomatic or mild illness cases is that once infected, that patient is infectious, shedding virus silently in their breathing, secretions, coughs, and sneezes. These are actually the most dangerous cases to families, contacts, and to the broader population, especially those who are so vulnerable to COVID-19. Many aren't being careful, acting as if this pandemic is over and that they can go back to business as usual. And I must say, this is a mistake right now. Thankfully, people are behaving themselves in such a way in businesses, and infections from those sectors are present at very low levels. So be careful, be considerate, and be patient. Antibody studies will be coming soon. Vaccines are being tested. Medications that block COVID-19's invasion into our cells are being tested, so these give us reason for hope if we behave responsibly and reasonably. There's still no need to panic. Now that's my story and I'm sticking to it, and I'll be back in a few days with an update for any major changes, or if there's something of interest regarding your health and wellness, because all this really is meant to serve and bless you. Thanks for your attention.